We're going to focus now on the psychology of the interview. I'm Dr. Barry Nierenberg. Now, when you do get an interview, you want to be able to put yourself in the best possible light. So before the interview, prepare yourself emotionally. Preparing emotionally for the interview can be very important. The right mood will help you perform at your best. So think about trying the following points in preparing yourself. Get yourself moving. Go for a walk, a run, exercise, do some meditation, some yoga, stretch, dancing. Sing your favorite song while driving to the interview. Repeat an inspirational phrase aloud if that's meaningful for you. And always remember, it's okay to be nervous. Now, not only is it okay to be nervous about an interview, but it's essential for you to accept how you feel. Telling yourself you should feel differently than you do is both unrealistic and will only make you feel bad about yourself. Being nervous could indicate merely that the interview and its outcome are important to you. Think of your interview as a first date. So instead of looking at it as the Inquisition, you can understand that you're both trying to figure out if there's a match. This mindset can give you many advantages. You come off as curious and not desperate. You can talk about what makes you special instead of just passively getting bombarded with the school's probes, and you're more likely to ask the questions that you think are important during the interview. These are the questions that will help you best assess if you really want to attend this medical school. Treating the interview as a first date, you'll both be better informed when deciding whether there's any future in it. Now, keep in mind, the medical school is interested in you as a person, your experiences and your opinions. Do take the time now to sit down, think about you, who you are, and what you've achieved. Now, when you get to the interview, that old adage is true. You never get a second chance to make a first impression. Now, some points here to remember are, remember to smile. It's one of the things which may matter in making your first impression. Good smiles always please people. Don't forget a nice firm handshake, and give eye contact without glaring, because that's a way to show that you're confident. Now, interviewing is about selling yourself. The product you're selling is you, so give them reasons to buy. Tell them what you can do for them. Emphasize what you bring to the school. And absolutely don't forget to listen. Listening is one of the most underused interviewing skills. Most candidates are so nervous about answering interview questions correctly, they forget to listen. So follow these tips. Use eye contact to show you're listening. Make sure your body is positioned so you're showing non-verbally that you're listening. Listen until the speaker is finished and do not interrupt. One common mistake that many candidates make when interviewing is talking way too much. It's important to listen to the question asked and answer that question. Keep your answers to 2 to 3 minutes at the most. When you limit your time, you tend to stay more focused. Be enthusiastic and positive. During the interview, show how enthusiastic you really are. Focus on your positive achievements and views, and try to avoid bringing up negative points about previous experiences. And always be honest with every question. There's no need to lie about your background or your skills. If you do get caught, then you will definitely not get accepted, or you might even have your acceptance rescinded. Background checks are the norm now. The best interviews, in my experience, have a give and a take feel to them. To do this, you need to ask questions, try to draw out your interviewer instead of just talking about yourself nonstop. When it does come to talking during an interview, many times less is more. A general rule is you should speak 1/3 of the time and definitely no more than half the time. When it is your turn to speak, don't hesitate to talk about yourself. Do try to collect the business cards of everyone you meet with. If that's not possible, make sure you have a small notebook handy to write down the names in case there's someone you don't get a card from. The follow-up letter is an important part of the interview. After you return from your visit, write follow-up letters to your interviewers. If you interviewed with several individuals, plan to write each one a customized letter. And above all, good luck.
Hi, I'm Kenneth E. Johnson, Associate Professor of Obstetrics and Gynecology, and I've been asked to tell you about the importance of professional dress during the interview. First, I'd like to dispel any myths you may have about the importance of professional dress during the interview. And yes, professional dress is very important. It gives the committee their first impression of you as a candidate. Most importantly, you don't want anything you wear to give the admissions committee cause for concern. So let's discuss how you should dress professionally for the interview. First, both men and women should wear clean, pressed, and attractive business-style suits. Although there are many colors, dark gray and blue are most often recommended. Because you want your first impression to be professional, don't even think about wearing something that's casual. If you feel something you are wearing may not be appropriate, it probably isn't, so don't wear it. You may want to have someone you respect take a look at what you're wearing and tell you whether or not it looks professional. Finally, attractive, well-polished shoes are also an important part of the professional dress during the interview. By taking the time to dress professionally, you'll give yourself the best chance to make a great first impression and have a great interview.
Hello, my name is Dr. Anthony J. Silvani. I am the Dean at Nova Southeastern University College of Osteopathic Medicine. I would like to take a few moments to talk to you not about Nova Southeastern University or the College of Osteopathic Medicine, but about your desire to become a physician. Medicine is a very special profession. It is actually magic. The opportunities in medicine are far beyond anything that you can imagine. People will trust you with information and personal data that they will not share with anyone. Not their spiritual leader, not their parents, not their spouses, no one. But they will trust you. And with that trust, they will allow you and hope that you will examine their body in the most professional way, looking to help them with a better quality of life and possibly a quantity of life. In medicine, you get to be the first person to touch a new living being. To deliver a child is so magic and such an opportunity for you to see the transition as that child is born into a breathing, living person. You will also get to see death. In today's world, people do not see the transition. Someone gets sick, they go to the hospital, they die, and then you see them in the funeral home. The realization is you will participate in that transition. And in that transition, you will see the power and strength that some individuals have in their religious belief and their understanding of the fact that life is a cycle. With that strength and knowledge that you gain from these people, you will help others who do not have that power or that strength or that belief, and therefore help them through that transition. All of this makes up the magic of medicine. I know that there are other professions that you think about, but believe me when I tell you, all professions have challenges today that are different than ever was. And someone has told you, do not go into medicine. It is no longer what it used to be, or it is no longer a wonderful profession. I can tell you without any doubt that if you follow your dream and do become a physician, that you will find that the joys, the satisfaction, the professional opportunities will exceed anything that you can imagine. So please, do not surrender because of others' opinions. And I wish you well in your pursuit of becoming a physician.